So good evening. Welcome to our EDS Awareness Educational Series webinar. My name is John Furman. Before we introduce our speaker, we'd like to give an overview of our free program for those attending for the first time. So we'll go over who we are, what is our program, a new program that we just announced, and introduce our speaker, and then we'll have a Q&A at the end. So again, my name is John Furman. I manage the National EDS Awareness and Chronic Pain Partners nonprofit organization based in Cincinnati, Ohio. My daughter, Deanna, leads the Cleveland, Ohio EDS support group. She was diagnosed with hypermobile EDS in 2008, the same year my wife passed away with breast cancer. I was a caregiver for my wife, who struggled with undiagnosed EDS for over 30 years. We introduced our program at the 2012 EDNF conference to help EDSers form independent local support groups and spread EDS awareness in their communities. We have been a sponsor at these conferences for the last 7 years, and we've started over 100 groups to date. Each group is given their own free website with a link from the directory and map. We receive feedback that conferences provide valuable information and social opportunities that many cannot afford physically or financially to attend in person. So we decided to bring the speakers to you through the free EDS Awareness Educational Series. We typically meet monthly at 7:30 Eastern Standard Time. All the programs are free. The meeting announcements and whenever possible, the recordings will be posted on our website at edsawareness.com for later replay. You can receive email announcements for future sessions by requesting the free report on our site. Tonight's presentation is sponsored by Body Support Store, where you will find over 250 products selected by EDSers for EDSers, proceeds from our store, and donations to our nonprofit organization help fund our programs. Please visit our store and check out the helpful products that we offer. Just a general disclaimer, this presentation contains general information about EDS. Members of the EDS community voluntarily participate in this program. The information is not advice. If you are having medical problems now, please call 911 or the emergency services in your location. Always consult your doctor before making any changes to your treatment. So we're very excited about the Physician CME educational program we introduced in September of 2017. It provides free continuing education credits for physicians who need to renew their licenses. It's receiving an overwhelming response of over 1,000 registered participants to date. It is the first online EDS course providing CME credits. It covers diagnosis, classification, and treatment of Ehlers-Danlos syndromes and associated conditions. Any healthcare provider interested in learning more about EDS is encouraged to view the presentations whether or not they desire the CMEs. As a patient, you have an opportunity to make a difference and provide awareness and understanding of EDS by encouraging your physicians and healthcare providers to participate. You can provide them with a website address, or you can print the brochure that's available on the CME site. Go to the top menu and click on brochure, and it's the button all the way to the right. There you can download or print them yourself, or there's an option to actually easily order multiple color copies from our VistaPrint link, providing a 20% discount for the print service. Watch the webinar also on the homepage that describes more about this program. To view upcoming speakers, visit the webinar page at EDS Awareness for the full schedules. For those attending live, there'll be opportunity for Q&A after the presentation. Add your questions and click on the question button on your panel. Then type the question and click submit. Sorry, our speaker this evening is Bonnie Nasar. She's going to talk about optimizing nutrition to decrease brain fog, fatigue, and chronic pain. Now, Bonnie is a registered dietitian and a fellow EDS warrior specializing in nutrition counseling for chronic pain and neuro-inflammatory diseases. She is also a mother of 4 children, 2 of whom have EDS. Bonnie has a telenutrition private practice. Bonnie graduated magna cum laude from New York University with a Bachelor of Science in Nutrition and Food Studies. She completed her dietetic internship through Connie Hunter in New York City. For over 20 years, Bonnie has been a registered dietitian, nutritionist, working with every age group from babies to the elderly. Her areas of specialization include mast cell diseases, Ehlers-Danlos syndrome, and chronic pain. So I'm very pleased to introduce our speaker this evening, and Bonnie can show her slides. Okay.
Hi, thank you, John. Welcome, everyone. So John gave you a little bit of my background. So I've been an EDS and POTS warrior for about 5 years, a little longer, because of course, like most people, I wasn't diagnosed until years, after I had symptoms. In hindsight, really since infancy, bruising, hypermobility, episodes of being unable to stand without passing out, hemorrhaging after minor surgeries. I tore my rotator cuff while breastfeeding one of my babies, dislocated and sprained ankles several times. And what happened was, one day I said to myself, okay, I don't remember the last time that I wasn't in pain. So let me treat myself. I'll make myself an appointment for a massage. And the massage therapist, when she was working on me, she said to me, your connective tissue behaves very strangely. When I release it, it's supposed to spring back, but yours does not do that, and you should get that checked out. So of course I went home and I looked up, connective tissue, and I found hypermobile EDS. So I made an appointment with a geneticist and got the diagnosis. And before I was an EDS warrior, as John mentioned, I was a warrior for 2 of my 4 children who have mastocytosis. They were diagnosed at 2 months old. They're now 14 and 16, and they're doing awesome. We manage their symptoms. It's not easy, but it's been a long journey, but they're doing fantastic. So that's kind of my story of how I got here tonight to be talking to you guys. And a lot of people ask me the question, how did you know that you had EDS? Well, you know you have EDS when going out describes your joints rather than your social life. And I'm sure a lot of you can agree with that. So that's our little funny for the night. I want to go over with you the presentation overview so that you know what to expect. We're going to go over what the 3 macronutrients are. We're going to get a little bit into the pathways that make energy from food. I don't want you to get lost when the science comes in. This background information it's important. I want you to come away from this webinar with an understanding of how our bodies produce usable energy from the foods that we eat. Then we're going to discuss some research, and then we'll get into the protocol. So, what can nutrition do for you? While it cannot cure EDS, we don't have a magic pill for EDS. What we do have are treatment modalities. So we can lessen the severity of our symptoms with these treatment modalities. And as you use these treatment modalities, you can add them all up, and that can translate into more daily spoons for you. So we've all heard of the spoon theory, I'm sure. And tonight, what I hope to do for you is to show you how you can get more spoons by optimizing your nutrition status. So what symptoms can we address nutritionally? Well, we can address gastrointestinal issues by altering your diet, and we'll see later how we can address the neurological brain fog type of issues, the fatigue, the chronic pain, and the nutrition deficiencies. By optimizing your nutrition status, you can address both the known and the unknown deficiencies, which can play a part in your symptoms. So, a known deficiency would be, for instance, if you had blood work and you checked, for instance, your vitamin C level, and you were found to have a low level of vitamin C. So blood work can sometimes find a deficiency, but sometimes doctors and dietitians need to look at symptoms and try to support the organs and the mechanisms in the body that might be affected based on current research. So, the macronutrients. Are all calories created equally? Does it matter what the makeup of our calories are? And, so the macronutrients are the larger nutrients that we eat. So until our health suffers, we don't kind of think about this. Where do our calories come from, and does it matter on a cellular level? So the macronutrients are proteins, fats, and carbohydrates. Proteins are made up of amino acids, fats are made up of fatty acids, and carbohydrates are made up of simple and complex carbohydrates and sugars. So which of these are essential for the body? And by essential, I mean we can't live unless we eat them. It's protein and it's fat, and it's not carbohydrates. Carbohydrates are actually not essential. Even though the food pyramid tells us to eat about 60% of our food as carbs, our bodies can manufacture glucose as needed from other sources of calories. So we do not need to eat them in order to live. So proteins are amino acids, which are the building block of the proteins. We ingest them, we break them down, and then we combine them again to build what we need, whether it's repair of organs or muscles, tissue, etc. So there are essential amino acids, like I said before. Some proteins are essential. So the ones that are essential are histidine, isoleucine, leucine, lysine, phenylalanine, threonine, tryptophan, and valine. When we eat proteins, this elicits a release of satiety hormones, so it signals to our brains to stop eating, which is a good thing. But if we do eat too much protein, it can tax the kidneys, and it also can be converted into stored energy in the form of either fat or glucose. So we can actually manufacture sugar from protein. So carbohydrates, there's the simple carbohydrates like the sugars. Those will increase your insulin levels rather quickly. And then there's complex carbohydrates like fiber, which are good for digestion and elimination. The complex carbs are rich in nutrients. They're good for healthy people with healthy bodies as part of a varied diet. But what about for people like us? So we're going to talk a little bit about blood sugar and insulin. So the pancreas is the organ that ensures that the body and the brain get enough energy in the form of sugar. What does that mean? So here's a sort of a little pictogram that'll show you the pancreas will release insulin to lower the amount of sugar circulating in the blood, or it'll release glucagon to increase it. This sugar that's circulating in our blood is used by the cells, including the brain cells, to turn usable energy, to turn it into usable energy so that they can function. Insulin is known to cross the blood-brain barrier, and that means that it can get into the brain. In Alzheimer's patients that were treated with insulin, we saw improved function of memory. And this research seems to indicate that Alzheimer's disease could be a metabolic disease with progressive impairment of the brain's ability to use glucose and or respond to insulin. So our brain let's go back. Our brain comprises 2% of our body, yet it consumes over 20% of our glucose-derived energy. So this is true for healthy adults, and what this means is that our brains need a lot of energy to function. So the issue here is, what if, like in the case of the Alzheimer's patients, our brains aren't doing a good job metabolizing glucose for energy? So I'm sure a lot of you can relate to this meme. What if I told you that I can't remember what I wanted to tell you? I'm sure a lot of you can, remember lying awake at night worrying if you have early Alzheimer's because you can't remember anything. Your brain fog is just, over the top. Brain fog it's a really difficult symptom to live with. As I mentioned before, scientists are now learning that Alzheimer's patients have difficulty using glucose in the brain for energy. This research, while not directly related to EDS, is really a fascinating breakthrough. We know about glucose intolerance with regards to diabetes, but now we're seeing that glucose impairment affects the brain as well. Having type 2 diabetes diagnosis increases your risk of developing Alzheimer's. The data suggests that an imbalance in brain function and metabolic status share underlying pathophysiological mechanisms and common intracellular signaling molecules. So if this is true, targeting those underlying issues could serve as a new way of treating these types of disorders. So let's talk a little bit about disturbed glucose metabolism in the brain. So what happens when the brain doesn't process glucose efficiently or properly? Well, the brain doesn't get the energy the way it needs to. And, there are a few theories as to why this occurs, but, as yet scientists are still don't have the exact answer. But we do have some studies that give us a little bit of insight. So this study, which is kind of a mouthful, basically this study looked at the results of metabolic issues in the brain. And when glucose metabolism in the brain is impaired, there is an increase in neurodegenerative brain diseases. We also have another study talking about elevated glucose levels in non-diabetics and how it correlates with an increased risk of Alzheimer's. Again, in this study, what was interesting is that these were not diabetics, but they had elevated glucose levels and they had increased risk of neuro-inflammatory brain diseases. Okay, so now we're going to go back to our last macronutrient, and that's fat. So we have essential fatty acids, just like we have essential amino acids, and they're essential for life, omega-3 and omega-6. They cannot be produced by the body. Omega-3s have been shown to lower inflammation, and typically the American diet is lacking in this essential fatty acid. So fat, the effect of blood sugar on blood sugar, it actually seems to offer a better glycemic control than a low glycemic index for diabetics in a few studies. So what if we switch out the carbohydrate content for fat in our diet? How does that affect the brain? Well, the brain starts to make ketone bodies out of the fat. And ketone bodies are sort of what fat breaks down into. Some people call them ketones or ketone bodies. And what happens is the body will start using these ketones for energy. Now, this requires less insulin because only glucose needs insulin to get in and out, to be regulated. So the other thing is that our satiety mechanism is increased when we have higher fat in our diet. Ketone bodies will circulate in our bloodstream similar to glucose, and the glucose levels will actually normalize when you're eating a lower carbohydrate amount because you're replacing it with fat, and you have less of a need for insulin. So let's talk a little bit more about the ketones. We'll get to the next slide, which will show us a pictogram. But ketones actually can bypass glycolysis in the citric acid cycle. The body and the brain need to make ATP for energy. That's our source of energy for the brain, for the body, what have you. So we can do this with glucose, or we can do this with ketones. When we use ketones as our main source of energy, it is what you've heard about called the ketogenic diet. And this is a diet that is low in carbohydrates and high in fat. By using ketones as an ingredient in the recipe for ATP instead of glucose, especially if there's an issue in the metabolism of glucose in the brain, we have now bypassed a couple of steps in the process, allowing the brain to get energy again, this time in the form of the ketone bodies. Ketones are actually more energy efficient than glucose, and we'll look at that in the next slide. So our liver can use fat to make these ketone bodies, and they're made from long and medium chain fatty acids. These ketones get released into the bloodstream to be made into ATP, which is usable energy for cells. This is really an evolutionary survival type of mechanism, so that when there was no dietary glucose available, like in periods of starvation, humans were able to survive on fat stores. Without this mechanism, in times of famine, humans would not have survived. So here you can see where it enters the Krebs cycle, and you can see that the ketone, so here's where glucose would enter. Glucose comes down here and enters over here. Fatty acids enter here. So they're further along in the cycle. So you're kind of skipping over or bypassing certain steps of the Krebs cycle. So, what does this mean? It means that it's possible that for some people, the brain functions better using ketones rather than glucose. And one hypothesis of this is that there's a dysfunction in the step to change glucose to energy. And because ketones enter the cycle later downstream, we can circumnavigate this issue. Let's talk about inflammation here. I'm sure everyone's very familiar with inflammation, unfortunately. It causes widespread pain throughout the body. It can affect the brain and cause brain fog, usually due to circulating cytokines, which is found in many neurodegenerative brain diseases. And this can affect your neurotransmitters, which can then affect, pain, brain function, depression, anxiety. Unfortunately, there are not many studies looking at EDS and brain inflammation. So what we're going to look at is some research that looks at inflammatory issues, particularly that of the brain, but not related to EDS. So in a world filled with Kardashians, be a Curie. And I really love this meme. No offense to the Kardashians, but we need less influencers on social media in this modern world, and we need more scientists. So, unless the Kardashians want to use their influence to raise money for research, we desperately need more EDS research. So here's a study about inflammation and the ketogenic diet. And this was done on mice. And these mice in this study had decreased central nervous system inflammation and had decreased memory impairment on a ketogenic diet. They also actually saw reversal of brain atrophy in the mice. And the diet seemed to suppress inflammatory cytokines. So one theory about the ketogenic diet and neurologic disease reversal is that ketones can influence cytokines and neurotransmitters. Here was a study about depression. Patients with depression got a PET scan before and after 6 weeks of an antidepressant treatment. And what they saw on the PET scan was an increase in glucose metabolism after medication treatment. So, this really begs the question, are depressed brains malfunctioning because they cannot take in enough energy to meet their needs? Because when we treat them with the antidepressants, they are able to increase their glucose metabolism. Migraines. This is really one of my favorite studies. This was a study in 1930, and that was a long time ago. Researchers found that 39 out of 50 patients were able to eliminate migraines using the ketogenic diet. Eliminate them. And this was in 1930. So we've known for about 100 years that the ketogenic diet drastically improves seizure frequency in patients with uncontrolled epilepsy who don't respond well to medications. We don't know exactly what the mechanism is, why this occurs. And this is an old study, but it does show us that ketones can have a significant effect on the brain. Here's another rodent study about chronic pain and the ketogenic diet. So in rat models, those who were fed a ketogenic diet felt less pain and had less inflammation than those fed a traditional diet. And you can see the paw swelling and the inflammatory fluid in that little diagram. The control diet had more and the ketogenic diet had less. There was another study that showed that the ketogenic diet seems to increase levels of AMPK. And AMPK is a substance that is a source of pain relief in the body. It acts as an analgesic. And in fibromyalgia patients, researchers have found that patients have difficulty manufacturing glucose for energy. They also have underactive AMPK. And when they increase or activate the AMPK, they're able to decrease the pain level in fibromyalgia patients. So the ketogenic diet seems to be an anti-inflammatory diet. The body reacts differently to a high-fat diet when it also contains carbs, though. To be effective, we have to limit carbs in a ketogenic diet. So some studies that you might hear about show that a high-fat diet is inflammatory. But in those studies, the high-fat diet is also high in carbohydrates. So this could possibly be, again, because of the metabolic pathway issues that are still occurring when glucose is available, like we discussed earlier. Future research, we need human studies, we need EDS and diet research. I'm happy to report that there is a research fund currently on the EDNF website, and this is a study that's going to be taking place in the UK by Professor Dr. Aziz and Lisa Jameson, and this is going to be about EDS and diet. Now, I'm not really sure what kind of diet they're going to be studying. I've reached out to Dr. Aziz, but I haven't gotten a response. But based on information that I saw online, it seems to be that they're going to be studying a low-carb diet. This I pulled off of the Ehlers-Danlos Society website. So, I just wanted you to see what the EDS Society's stance was on diet. They certainly do believe that the diet can have an effect on our symptoms. And again, they're recruiting for the UK study to fundraise it. I'm assuming once they finish the fundraising, hopefully that'll be soon, they expect that the study will take 18 months to complete once they begin. So unfortunately, we're not going to have data on that for a while, but it is super exciting to me to see diet being studied. So let's get to the Nasar Nutrition EDS diet protocol. And let me preface by saying that your diet should only be altered with the permission of your physician and under the care of a registered dietitian. This presentation is not a substitute for medical or nutritional care. So this is a diet that is high fat, moderate protein, and low carbohydrates. I do like to emphasize that this is a multidisciplinary approach. I recommend the Muldowney exercise protocol, which can be purchased online. It's gentle physical therapy exercises written by a physical therapist and specifically for EDS. It's very important for proprioception, for proper body alignment, and injury prevention. Supplementation is also very, very important. We see a lot of deficiencies in EDS patients in several micronutrients. And then, there's also going to be micronutrient supplementation required due to the ketogenic diet. So this is a diet that is based on whole foods, primarily made up of fresh vegetables with moderate amounts of protein and low carbohydrates, while using good fats such as olive oil and avocados. And I like to call this the Mediterranean ketogenic diet. The diet needs to include foods as close to how they were grown as possible, staying away from packaged and processed foods. So what do I eat? And this is a question that I'm asked very, very frequently. So we start with the low carbohydrate vegetables, for example, leafy greens, cabbage, cauliflower, broccoli, celeriac, rutabaga, pumpkin, delicata squash, zucchini. Basically vegetables that are very nutrient dense, but are also low carb. And this is kind of the base of your meal. And these are a few examples of ones that fit into the diet. Protein. So this is moderate amounts of protein. We don't go overboard on the protein for the reason I said earlier about being able to manufacture glucose from protein. We don't want our bodies to do that. So free-range chicken, wild-caught fatty fish, eggs, tofu, soybeans, lupini beans, hemp seeds, pumpkin seeds, dairy, small amounts of lean beef, Beyond Beef burgers and crumbles, which are made out of pea protein, which is more of like a keto approved vegetarian source of protein. The best fats are avocados, olive oil, nuts and nut oils. Dairy and heavy cream can be used in small amounts. So the breakdown of the macronutrients are 70% fat, 20% protein, 10% carbohydrates, and this is an average. You can be slightly above or slightly below. Nothing has to be exact with this as long as you are producing ketones. And again, I should also say that especially with our patient population, it's always best to get into ketosis gradually and not just go from the typical American diet one day to the ketogenic diet the next day. There needs to be a slow tapering. So what are we doing? Basically what we're doing is we're swapping out the carbohydrates in a typical American diet for fat. And it has to be the right kind of fat. And, I kind of like to call this more of like a responsible ketogenic diet. We cannot just throw away all the research that we know about saturated fats. So this is a slide that I actually pulled off of Instagram. And someone, well-meaning, but without a degree or any, education, put this up. So the truth about keto, this is what people think it is, here's what it actually is. So these are both wrong. That's not what a ketogenic diet should be. This is a medical grade diet. A lot of research has been, put into this. A lot of thought has been put into curating this diet. This is what it should look like. You have your fatty fish, you have your nuts and your seeds, your avocado, you've got lots of greens on the other slide. So that's what we want to see on your plate. And this would be a true Mediterranean responsible ketogenic meal. So for any Fortnite fans out there, here's a victory royale dance. And the reason he's doing that is because he's fat adapted. And what fat adapted is about 6 weeks after you are on a ketogenic diet, you will be what is called fat adapted. And this means that your body is used to using fat for energy, and it is likely that you can increase your carb amount to find your sweet spot for how much carbohydrates you can eat while still maintaining ketosis. And this is really important because we don't want to just leave you hanging with a very low amount of carbohydrates. It's always best to try to include more foods. So this would be the part where you could sort of liberalize your diet. And the way I like to do this is with using a blood ketone monitor. Everyone's going to have a different threshold. Everyone's going to be affected by foods differently. So it's always, a good idea. You can check your blood ketones with a monitor, and it's just like a little tiny pinprick similar to what diabetics use to check their blood sugars. Guidance from a knowledgeable physician or a dietitian is recommended due to the complexity of the nature of this way of eating. There are issues that can arise with fluid intake, with missing vitamins. So it's very important also to track your meals with an app to look for potential deficiencies sometimes. If you're not sure if you're hitting your macros or your micronutrients, you can always just log it into an app and see where you're at. And I'll have some recommendations on my website for you if you want to look at the recommended apps and blood ketone monitors. So is this the perfect diet? No, it's not. But for those of us who have a decreased ability to function in our daily lives, when quality of life is at stake, this way of eating can mean the difference between being on disability and being able to hold down a job. It could be the difference between having gut-wrenching guilt for not being able to keep up with your kids and taking them on a trip to Disneyland. I can tell you personally that I did not think I would get to the point where I'd be able to work, to give lectures like I'm doing right now, to have a private practice to help people. 2 years ago, I was in constant pain. Brain fog was debilitating. The fatigue was exhausting. So, just to sum it up, this is a medical grade diet for those with loss of quality of life. So that is kind of my take-home message for everyone here. So when you do see an EDS or a diet who's feeling great, you want to try it too, don't you? Let's talk a little bit about vitamin supplementation. So both, like I said before, the ketogenic diet and EDS have circumstances that put our population at risk for nutrient deficiencies. So micronutrients, again, these are things that are essential but in much smaller amounts for us to eat. Vitamin C, magnesium, calcium, L-carnitine, B vitamins, potassium, sodium, and probiotics, which is not exactly a micronutrient, but it is important. So vitamin C, a lot of the deficiency signs for vitamin C kind of go hand in hand with what we see as EDS patients: the bruising, bleeding of gums, skin issues, anemia, fatigue, joint pain, headaches. Calcium. So studies actually indicate that EDS patients have a lower bone mineral density when it comes when it's compared to the general population. So we do need to be mindful of that. L-carnitine. So this is an amino acid, and it's important for transporting fatty acids into the cell's mitochondria. It's mostly found in meats, fish, poultry, and dairy. Symptoms of deficiency include muscle aches, fatigue, and brain fog. So again, similar to things that we typically see in our patient population. And in clinical trials, fibromyalgia patients had improved psychological symptoms when supplementing with L-carnitine. The B vitamins, so particularly B12, which can cause issues for us. And again, if you're eating a very low carbohydrate diet, you're probably missing out on some B vitamins. They're easy enough to supplement in a multivitamin or B complex. So potassium and sodium, these are very important electrolytes, especially for anyone out there who has a POTS comorbidity. They help to maintain fluid and blood volume in the body. And drinking too much water actually can dilute your electrolytes, so you kind of want to find a happy balance there. And additionally, a ketogenic diet requires more potassium and sodium than the traditional American diet. So probiotics and prebiotics. So, leaky gut is something that's kind of common in EDS. Probiotics can help to improve our intestinal bacteria, and the prebiotics are like the food for bacteria, for the good bacteria to take hold in the GI tract. So we know that there are circumstances in which the gut will leak food particles or other toxins into the body, and that can lead to inflammation. Healing the gut for those that are symptomatic, that can help with your symptom management. And part of healing the gut is making sure that the stomach does have the right kinds of bacteria. So the probiotics are those good bacteria that we want to host. So we ingest them and hope they take hold. The prebiotics, like I said before, these are substances that will help support the good bacteria. One thing to note is we do need to be mindful for those with any comorbid mast cell diseases. Some strains of probiotics can actually cause mast cells to react. So we do have to be mindful of using the right ones if you do have a mast cell issue. So for chronic pain, fatigue, and brain fog, unfortunately, there are no concrete answers from research regarding EDS and nutrition. We need more studies. So until then, we're going to work on anecdotal evidence and peer-reviewed published research that is available and addresses our symptomology while not addressing directly Ehlers-Danlos syndrome. So I do really believe that anecdotal evidence and research done on parallel diseases and symptoms, when it really does show us that a low carb, low glycemic, low diet can certainly help us. We know that the ketogenic diet can alter brain functionality. I don't have all the answers yet. No one does, but I'm here with you along this journey, and I am so thankful to be able to share this with you guys tonight. So I really want to thank you all for listening. And I also want to thank my family. I would not be here tonight if it were not for my 4 kids, 2 of which are the driving force for my intensive study of EDS, mast cell disease, and POTS. I'd also like to thank my amazing husband, who has been my rock in sickness and in health. And lastly, I hope I don't tear up, but this is my dad, truly amazing and outstanding physician. He was a pioneer in the field of chronic illness. He passed away earlier this year, and he inspired me to become a registered dietitian. And if it weren't for him being so amazing and so encouraging, I would not be here tonight. So this is my information. You can find some helpful information on my website. I put it on its own page, the Ehlers-Danlos syndrome page, if you look at the bottom of this page. And you can go there, or you can go to nastynutrition.com and click on the Ehlers-Danlos page. And now we will take some questions.
Thank you, Bonnie. That was very thorough and very enlightening. A lot of areas that we really have not been familiar with. So I really appreciate the thorough coverage. Are you able to see the questions under the question tab?
Am I looking at chat? I'm not sure I see a question tab, John. Are you there, John?
Yes.
Oh,
Let me read the questions, and that way, this is a new application. We're just trying to learn more about it. The first question: my collagen on my skin and probably organs are getting so thin and stretchy. What can I do to make it stronger and thicker?
Hmm.
Ah,
So that is a great question. And, unfortunately, because we seem to make faulty collagen, I don't think we have the answers, for that just yet. But certainly optimizing your nutrition, and supplementing anything that you might be deficient in, can be very helpful and could possibly ward off any issues. But of course, like I said in the beginning, there is no cure. We can't cure it. We can do the best we can, with nutrition and supplementation and medication and, other modalities. But we can't, change what we have, unfortunately.
okay. Well, this is a similar question, but it says, I'm really worried my veins are going to break. Will supplemental collagen help the veins get strong, and what nutrition will help?
So, a lot of people are very, into this supplemental collagen. So, what is collagen? Collagen is protein. So if we eat collagen, and we break it down into amino acids the way our body does, and then we reassemble them to, make more collagen in the body, um, if we're making it faulty, we're going to make it faulty again, unfortunately. There really haven't been any clear-cut studies that show an improvement. It's a protein supplement, so it certainly can't harm you, but it likely won't help either.
Okay. And the next question, are low ferritin levels a cause of fatigue, and are they common in EDS?
So ferritin.
Ferritin, yes.
Okay, so iron source. So absolutely, if you're anemic, and low iron would be anemia, you certainly can have fatigue from that, and you should address that nutritionally.
Okay. Is ketone diet doable when needing to be on a low histamine diet due to mast cell activation syndrome?
Yes. So, the low histamine diet is supposed to be more of an elimination diet. And, what a person should do with the low histamine diet is to, eliminate and then gradually add back and see what is tolerated and isn't. I can tell you that even from my own two children with mastocytosis, the foods that they can tolerate are very different. So everyone is going to have, a different tolerance for different foods. So, with the histamine diet, what I would say is ideally you would know which foods are your trigger foods, and you would follow a low histamine diet, figure out your low histamine, your foods that you need to avoid because they're high in histamine or cause a histamine reaction for you, and then start with the ketogenic diet. But yes, they can be done together.
Is there any way to determine if you have a problem with glucose metabolism? before
So
going to a ketogenic diet?
So, unfortunately, like, you could see in some of the studies, like they were checking like, how the brain is utilizing glucose, and it's on such a cellular level that other than research, they're not really looking at it. You could possibly look at like insulin resistance, so if there was insulin resistance where you did have, a high blood glucose level, those are things that can kind of, show that you might have a metabolic issue. There's always that struggle for clinicians, like, should you test everything under the sun and like, waste a ton of money on tests, or could you just, try a supplement or try a diet or try a medication and see if it works? And that's always a struggle. And I think every clinician has a different approach to that. But that's a good question. In an ideal world, sure, we would be able to do that with everybody, but I don't think we're there right now. We're only just at the beginning of understanding, what is going on with the brain and glucose.
Okay, what is the correct probiotics to use if you have mast cell issues?
So, that would really again be a little bit of an individual case. So I don't know that I'd like to give a specific type. There's just it's more involved. Definitely discuss that with your healthcare practitioner, and or knowledgeable practitioner with mast cell disease, and they can help you with that. But that is a good question and should always be addressed.
What if you have GP and can't eat many very leafy vegetables?
So that would definitely make it a little bit more difficult to implement. However, there are vegetables that are, lower in fiber and not, and would be more conducive to eating.
Okay. I tend to find I need to eat carbs before and after working out. How do you eat keto and still have energy needed for resistance training and cardio?
So there's actually a lot of super athletes that utilize a ketogenic diet, and what they find in studies is that they actually do perform better. Because you always have the fat stores, whereas glucose, we store glucose as glycogen in the muscles, but we don't store that much of it. So when we run out, you get fatigued. So if you're in a state of ketosis, obviously you wouldn't want to do this, but you have an infinite amount of fat stores essentially in your body, and you can utilize those fat stores to keep you going. So if you're eating glucose as your main source of energy, you're going to need more glucose when you're exercising, before and after. But if you're in ketosis, you do not.
Okay. What advice do you have for finding a dietitian that is knowledgeable about EDS? I don't want to go to someone who doesn't understand our complex symptoms.
So, you can always check the EDS website, and look for a practitioner in your area. And then, there's people like myself that work in telenutrition, meaning that, we work, via phone or video conferencing. So that's always an option.
Okay. Uh, Being J-tube def- defendant
Mm-hmm.
due to gastroparesis, how does Kate Farmer's peptide plus 1.5 compared to the diet you described? I don't know who Kate Farmer's.
Oh, okay. You know what? I would have to look up the macronutrients to Kate Farms. I'm not familiar exactly with the macronutrients offhand, but it can certainly be looked at. There definitely are ketogenic formularies because they use it in epileptics. So it can be
Okay.
done with a J tube.
Okay. So I went towards keto to help, and it certainly did help with pot symptoms. But I've discovered I have, uh, I'm not sure, is it celiac or
Celiac?
celiac sensitivity, which means I need to cut out so much. Is celiac sensitivity common with EDS? And same question for oxalate. Is it oxalate
Oxalate,
help?
yeah.
Yeah.
So, those are things that are very individual. It does seem that a lot of EDSers do have, and again, they call it gluten sensitivity. We're not sure. We don't know if it's the glucose. We don't know if it's the wheat. We don't know if it's just grains in general. Again, more research, needs to be done. But it does seem that we do have a greater patient population that seems not to tolerate grains in general or gluten. So the ketogenic diet is gluten free by definition. So those overlap just fine. And then as far as the oxalates, that's something that is more of an elimination type of a situation. So you would want to eliminate the foods that contain oxalates, see how you do, add them back in, and see if there's an effect. And then, and you can do that with a practitioner, and you go slowly, introducing one food at a time, and then move on to a ketogenic diet, without using any of the foods that affected you.
Are we amino acid deficiency in EDS?
So it doesn't seem that we are in, like, overall. If you're deficient in an amino acid, you can be, like, for instance, the L-carnitine. That's one that a lot of people are found to be deficient in. So you would want to supplement that if that were the case, that you were deficient in an amino acid. But, generally speaking, as long as you're getting enough protein, you should be okay. The issue that we have is taking those amino acids and building them into collagen that is not broken.
Okay. For malabsorption deficiency concerns, what are your recommendations to help with vitamin D, C, and calcium absorption?
So, supplementing is obviously, an important part. If you have any kind of GI issues like a leaky gut, or SIBO, small intestinal bacterial overgrowth, these are things that certainly should be addressed. Usually, if you have multiple deficiencies, something's going on in that GI tract that needs to be addressed. So that should certainly be addressed with a practitioner. And as far as individual, supplement issues, a lot of doctors like to give out like the 50,000 IUs of vitamin D, and it's taken once a week. And, it doesn't always help taking the one pill of a large dose once a week. Sometimes it's better to take like the 2,000 IUs daily, and you'll see an increase in your level, more so than just taking the 50,000.
Okay. Do you find that the SIBO is a common uh, commonality, or does this pose a challenge for tolerating ketogenic diet and fiber-rich foods?
So SIBO small intestinal bacterial overgrowth, and what that really means is that bacteria that's living in the colon kind of backs up into the small intestine and causes overgrowth there where it should not be. This bacteria will cause gas and bloating and malabsorption of nutrients. Depending on how severe it is, it can be treated with antibiotics. Sometimes it takes multiple rounds, of antibiotics to be effective. And there can be, the probiotics are obviously really important to repopulate the gut with the right kinds of bacteria. And the other thing that can help too is like spacing out your meals, kind of, every 4 to 5 hours, and that way you can starve the bad bacteria in your gut. And there's also contributing factors. So a lot of people with EDS, for instance, might have reflux, and they might be on a PPI, which will reduce your stomach acid. Well, reducing your stomach acid can actually increase your risk of SIBO. So we definitely see that we have a lot of GI issues in this patient population. I'm not sure that doctors really know why, or is it are we at risk because we're taking certain medications? If you can pin down the primary reason, certainly that'll help you target the therapy that will work best for you.
Have you ever come across patients with very high calcium in urine, but not taking any calcium supplement and minimal high calcium foods?
So that would mean that you're leaching calcium. And calcium, without getting into too much chemistry, is basic. So, acidic versus basic. So, usually people on a very high protein diet, they might leach calcium because the protein by nature is acidic, and then the body has to release calcium sort of to keep the pH level where it wants to be. That could be a possibility, but I've not come across that.
Okay. How realistic is it to adapt a Mediterranean keto diet with allergies to all nuts and eggs?
So it can definitely be done, but you would have to, certainly then include the dairy, include, other sources of fats and of proteins. So as long as you're not exclusive with other items, it can be done.
Okay.
And there's
Is
also
it
seeds as well that can be used.
okay? Is it possible to do the ketogenic diet with a low nickel diet? Most leafy greens are high in nickel. How can I do both?
So, that certainly is a good question, and that does present a challenge. This would be a case where I would say you would for sure want to track your nutrients with an app. Eating what you can, and staying away from what you can't eat, and just making sure that you're hitting, those percentages that I talked about with the protein and the fat and the carbohydrates. So, whenever you are more restrictive, for instance, being a vegan, let's say, or having the low histamine or anything like that, you want to track with an app and see that you're hitting the macro and micronutrients.
Okay. I've had my gallbladder removed, and I've found that I have trouble digesting significant quantities of fat in one setting. Any suggestions for the ketogenic diet?
So what's really interesting is it's actually not so much about how much fat you're eating. It's more about how little carbohydrates you're eating. So, it actually can be done in a lower fat way. Again, that would be, a diet that you would want to track all your macros and, keep sort of like a symptom diary to make sure, have small meals, maybe having 6 meals instead of 3 meals a day, so that you don't tax the body, what with not having a gallbladder. But, it's a possibility. It certainly is a challenge, though.
Uh, is the ketogenic diet safe? Uh, Enough worth trying, and the benefits outweigh the risks. Not sure what that means.
So we don't have long-term studies on the ketogenic diet. That's true. And that's really one of the reasons why I did so much research to curate this more of a Mediterranean ketogenic diet, because I do feel that we do have to pay attention to the research that we do have. And, we can't ignore that saturated fat, can cause heart disease. We can't ignore everything. While, we've seen that, for instance, since the 80s, what did we do in the 80s? We took out all the fat and all the food and we added sugar. And, it's, 2018 and look how well that worked out for us. So while that's not, a true study, that kind of does show us that collectively removing fat from our American diet did not make us healthier.
Okay. The fats you recommended have a high ratio of omega-6, 9 compared to 3, which I've heard can increase inflammation. Is it possible to do the ketogenic diet with mostly fish oils, etc.?
Yes. So, of course, fish oil supplementation is a definite, possibility for those that eat fish, and that can certainly be done. Including fatty fishes in your diet, is also very helpful. And again, like I said, with the micronutrients and using the app so that you can, track all of those, omega-3s and omega-6s and actually see a ratio, and see where your ratio is at is definitely important. And that can certainly, having the right ratio can support, the lower inflammation.
Do you recommend micronutrient testing? If so, which one?
So, again, I spoke a little bit about, the clinicians and deciding if you should test or kind of just treat. So, there's certainly many different labs that will test for micronutrients. You can get it done through your doctor, through your dietitian. There's SpectraCell is the lab that I like to use. But sometimes, it isn't necessary. Sometimes you can actually, change your diet and take supplements as long as they're supplements that are, not, there's no risk for overdosing on, that they're not, they don't get stored in excess amounts in the body, without going into too much scientific detail. But, it depends what it is. But I would say, I guess, if you're asking for a lab, I would say SpectraCell.
Okay. This is a little longer one, and it's back to the addressing the SIBO, and is that how you pronounce it? SIBO?
SIBO, yeah.
SIBO in EDS. I have yet to find a doctor in the UK who knows how to treat it within the context of EDS, mast cell activation, dysautonomia. I was given one round of Reflexum, which didn't resolve it, and then augmented Argumentin, which has made it much worse. Have you come across any ways to resolve this health condition?
So, usually it's a multidisciplinary approach in that, like, you do, antibiotics. And again, like I said before, sometimes you need more than one round of antibiotics, and then repopulation. So you're killing off everything with the antibiotic, but sometimes, that's not going to be enough, because then what's it going to repopulate with? You've got to make sure you're getting the good bacteria to repopulate. So using, for instance, an antibiotic without a probiotic, you're only doing half the job. So it would be worth your while to find a knowledgeable practitioner. Again, I'm not so familiar with practitioners in the UK, unfortunately, but maybe check out the UK EDS websites and see if they have practitioners on there that are knowledgeable.
Okay. You mentioned a couple free apps. Could you tell us more about it? And personally, I could put it on the website if you would send
sure.
me some links to the
So
website.
my favorite is Cronometer. It's Cronometer. And that's the app that I like to use. It's just very specific, and actually, it gives you like the omega-3 to 6 ratios of your diet. It gives you all the micronutrients and the macronutrients, and it's, I find that one to be the best specifically for the ketogenic diet.
Okay. If you could send me the link, I'd be
Sure.
pleased to put that out on the site.
Absolutely.
Okay, this is another long one. We have individuals all over the world that come out to these webinars, and this is a lady from Holland. And over here, doctors are very unknowingly about EDS and also unaware of GI issues, and that we hear all the time. I'm very underweight, but trying to avoid getting a J tube or G tube because of the bad stories I hear from fellow EDSers in Holland who have a tube. I would, however, concern about the mineral intake because I get a lot of micronutrients from Ensure, supplement pills, those kinds of things. How do I know whether to still go with a G tube to manage my GI pot symptoms without knowing the doctor who regularly doesn't understand these things? Wow.
Yeah, I mean
Yeah,
that's unfortunate. You know, again, I'm less familiar with Holland than I am with the UK, so I couldn't unfortunately recommend a physician or a practitioner. I'm not aware of anyone there, but again, going to your EDS support group is so important. You can get referrals from other patients, or you can look on their website if they have practitioners that they recommend themselves. If you have to, that sounds pretty, pretty medically complex, and certainly warrants, treatment. So I would recommend just finding the right practitioner at all costs in that case.
okay. Yes, we are getting many emails from other countries, and they say, boy, in the U.S., everything's great. You guys got all these doctors that understand what's going on. And I say, who have you been talking to?
It's true.
True.
We have to
But
seek them out, but they're hiding. We find them.
yes, we definitely do. Well, that is the end of the questions, and I certainly appreciate your patience going through that. Next time, I'll figure out how to get the presenter to be able to see the questions, so I don't have to read them. But this has been an extremely educational program for nutrition. It's one that we've been asked for multiple times, so I really appreciate you filling that gap for us. And any summary that you might provide to us, and are you available for consultation? It was another question we had.
Yes, so I am available. You can contact me through my website. I guess really like the main takeaway is we don't have answers. We just have to do what we can with the information that we have. And, I definitely tried to, for many years, try to work on a program that would work for our patient population. While there's no one size fits all, and everything does, need to be individualized, as was shown with the questions of, the low histamine diet and people with SIBO or gastroparesis. So it is important to work with a practitioner to get to where you need to be. But I'm just happy to be sharing my information with you guys, and I'm grateful for our EDS community. And thank you, John, for allowing me to share.
Well, thank you, Bonnie, and appreciate all of you who have attended our webinars. We have them monthly. You can go out to the same Chronic Pain Partners site, and you'll see them posted monthly. You can get on our listing to get emails when they are announced, and also when the recordings are available. So you can go out and request the free report on our site and get that information. We have over 80 webinars on our site in the webinar page, and you can sort and find those by presenter's name and by specialty, by topic, and by location. So we try to make it very easy for you to find. We also have our physician training program. It's ehlers-danlos-cme.org. So please go out and recommend that to your physicians so that we can help educate not only our patient community with our webinars, but also our physician and healthcare providers community. So thanks again, Bonnie, and all those who attended. We will be posting this out on our site in the next couple of days. So good evening.
Thanks, John. Take care, everyone.
Bye-bye.